Hello and welcome to today's webinar, Unlock Business Value, the Power of Member-Centric Experiences. Before we get started, I'd like to review a few housekeeping details. Today's webinar is being recorded, and an online archive of today's event will be available within 1 to 2 business days. If you have trouble seeing the screen at any time during the presentation, please press F5 to refresh your screen on a PC or Command R if you're using a Mac. You may ask a question at any time during the presentation by typing your question into the Q&A box located on the right side of your screen and pressing Enter. And finally, I'd like to remind you of AHIP's antitrust statement located in the link just below the slide viewer. We will, as always, comply with that statement. Among other things, the antitrust statement prohibits us from discussing competitively sensitive information. We're very fortunate to have with us today Stacy Byers, Senior Vice President of Experience, Design, and Digital at Highmark Health. And from Citius Tech, Amy Heyman, Strategic Advisor and Experience Design, Rishi Matter, Vice President, Digital Experience and Solutions, and Shatang Patel, Vice President, Health Plans and Consulting. And at this time, I would like to turn the floor over to the speakers.
Thanks, Joanne. Much appreciated. I do want to take a moment to thank our panelists for taking the time today for what will absolutely be an exciting discussion, and looking forward to sharing their experiences with you and certainly gaining some perspective. So our objectives for today, as we get started, number one, we want to set the stage a little bit in terms of overall industry transition to personalized care. We'll talk about why member experience matters, discuss some industry-leading practices for unlocking business value and really thinking about member experience, the importance of human-centered design, and then finally, what is the path forward when we think about member experience and how we serve our members down the road. So let me first start by setting the stage. As you know, the industry is in the full mode of transition to personalized care, and the implications are vast. What does this mean, especially for our primary stakeholders, members, providers? How will members' experience change as they navigate and continue to navigate through a complicated healthcare system? How do we better enable our providers to deliver improved health outcomes, and not just health outcomes in context of clinical, but also where they deliver them, how they deliver them, and of course, outcomes that are equitable in nature. And finally, how we exchange data. It's not just exchanging data with our current stakeholders, but in the future, with whom will we exchange the data? What devices will we exchange the data with? So all of these dimensions are significantly impacted when it comes to this transition to personalized care. And certainly technology plays a huge role, whether it's through advanced analytics to form those precise cohorts that you want to attack, or how you exchange that information and get most relevant real-time information to conduct those analytics. With that, without any further ado, let's get our panel involved and let's get the discussion started. So, Stacy, I want to first start with you. In terms of today's consumer age, empowered consumers, members look for a lot of different options when it comes to what is best for them in terms of selecting a health plan. And there are a number of surveys that state more than 50% of members cite experience as a primary factor for switching health plans. So what impact can member experience truly have on retention of those members? And what are on other critical items for a given health plan?
Yeah, thanks for having me. So obviously, NPS is a great way to understand the retention and loyalty equation. Obviously not only in our industry, but in many others, it's been studied. And I think what's been interesting for me in the customer experience space is that initially when we went into studying NPS, a lot of people said, well, I don't really think the experience matters so much in the commercial space because the members aren't really choosing in most cases to be with Highmark. It's their employer that's choosing. And of course, that created some internal, conversation and friction sometimes when we were really thinking about experience initiatives. So we started to dig into that very question to look at how NPS might look different when you're purchasing on your own versus when you have an employer that is purchasing on your behalf. And one of the interesting things, and this is just the latest stat that I've got, we're seeing about a 20-point difference in NPS for ACA people, the 20-point difference between when they cancel versus when they stay with us. In the Medicare Advantage program, it's about a 30-point difference between when they cancel versus when we retain them. And in the group space, member NPS is 35 points higher when we keep the group versus when we lose the group. So there's a very significant difference in that, marker of experience in those cases where somebody's in group coverage. So to me, I would say experience does matter in all of those books of business. And I think the other thing that's important to remember is that experience is all about, right? Why do you have health insurance? You have health insurance so that you can get the care that you need when you need it. And when you think about, what's important from a business perspective in this space, it is getting people into care and hopefully getting them into care before they are in a situation where there's lots of chronic condition and a lot of cost. And so what we've seen is that when the experience is good, we are removing the barriers to that care, and that drives a lot of business value even beyond the retention, right? So you're making it easy for them to engage, you're making it easy for them to get the care, and frankly, you are showing up to deliver on the thing that they hired you to do.
Yeah, I love that, Stacy. It's so important to pay attention to the trends, and when you're measuring experience, whether through NPS or another measure, to start to spot those trends. But then it's like, okay, how do we react to what we're seeing? Because we're in this constant mode of figuring out what's best for members, what's best for customers, and in that we're crafting hypotheses and we want to test them. So I like to talk about predictive NPS, which is a method by which we can model a future state experience and start to get information on how that future state experience might impact NPS so that we know which programs to invest in. So we're spotting the trends, figuring out what will be better, and then figuring out, is our idea actually going to work, right?
Well, I think I believe
Certainly.
retention. Sorry.
Yeah, go ahead.
No, I was just saying that I think it's very exciting that Stacy, the way the numbers you projected around member experience and retention particularly is also about predicting, but also talks a lot about how we are avoiding the negative experience for the members, right? In terms of negative surprises for them. So that plays also important role when you are right in touch with your audience and your users to avoid it for them through the member-centric design and all.
Absolutely, and it's interesting the way you said it, Rishi, right? Because that positive experience or negative experience can depend on the type of member. So I do want to focus a little bit on that piece, which is how do we understand members better? Of course, members come with a lot of different characteristics, whether they be not just clinical, but more importantly, social, behavioral, other elements in terms of who they are and how they're different from the average pool. So my question, and again, Stacy, I want to start with you, is how do we understand our members better across our products that we serve and across the different backgrounds that we serve, and why is that important?
Yeah, I think it is important to know that people are people. They're not the product or the purchasing mechanism. And so while that product and purchasing mechanism can actually make a difference in their experience, right? Because you see situations where, Medicare Advantage members tend to have more predictable plan designs, maybe a better understanding of how healthcare works because of their years of experience. At the end of the day, we see people moving between commercial ACA and MA all the time, and you're still you, right? So a couple of years ago, we actually felt like that was going to be an important understanding that could inform strategic decisions at Highmark, as well as help us to inform some tactical decisions that we were making about how to engage. So we started to study behavior and motivation around health and healthcare. And we actually built a set of tools, a set of archetypes, and there are 6 archetypes that we validated through qualitative and quantitative research. And they're, people are pretty evenly distributed across those 6 archetypes. So like any one might get 15-ish to 20% of the population. And we see that, on the one side of the spectrum, you've got people who are highly motivated around health and healthcare, highly engaged. Those are the people that we don't have to work very hard to serve, right? We kind of naturally do it because they are seeking out care. They are actively engaging. They have the means by which to make better healthcare decisions every day. And, this industry would be easy if everybody was like that, right? You're just like, oh, it's all going to magically work and there won't be, this impact of long-term care costs and that type of thing. But we know that half of the population sits in that other spectrum of less engaged, less motivated, people who have more challenges and barriers to that care. And the tactics and interventions that work for a highly motivated group are not the same things that work for a group that faces more barriers and concerns. And so we've used that tooling for a couple of things. One, to have different kinds of strategic conversations internally about how are we serving people, who are we serving, but also to think about at the actual project level or the outreach level, thinking about the fact that different people may respond to different types of messages. And if you really want to reach somebody who's maybe less motivated or has more challenges to health and healthcare, you actually have to speak to them in a different way. You have to engage them in a different way. That flyer to go to get your PCP visit may not resonate with somebody who doesn't trust doctors and hospitals. So you might have to come at that in a very different way than you would for somebody that has a lot of trust in the system. So I think it's just really important for firms to remember that humans are human and motivated by things that go well beyond the way that they purchase their coverage.
Yeah, I totally agree with that, Stacey. People are complicated. Our lives are messy. We're all different behaviorally, what's going on in our lives, our moment in the healthcare journey. What is our gap? What is our obstacle? What is our hope? What moment are we in? And I think, especially in health insurance, it's important to customize the experience per the plan. Obviously, people are in different plans, but like you noted, they're a person who might have different plans over the course of their lives. So let's look at them as a person, not just a plan member, and take that heritage and that history with us. But then also, how do we personalize the experience for their preferences, for where they've been and all the information and data that we have about them, and where they hope to head. And then how do we also contextualize the experience, again, for the moment they're in. So customize, personalize, contextualize. I think all of that is with respect for our humanity, getting the right information to the right person at the right time, connecting people with the person they need or with the information they need. I'm actually really enthusiastic about the notion of synthetic personas, even though we're trying to balance humanity with AI. But why I'm excited about synthetic personas is if we can have living archetypes, living personas. When I say living, I mean not something you do, an academic exercise and then you sort of put it on the shelf. Okay, we understand our members, now we don't need to think about them anymore. But a way by which to continuously absorb information and get a compelling representation of the trends, the patterns, the themes, and the needs to inspire our work ongoing so that we don't lose touch with the situation. And through that sort of lens, we can make sure we don't lose touch with any given population so that what we're doing is also equitable.
So I jotted down some keywords, right? Archetypes, tooling, customize, contextualize, synthetic personas. This sounds complicated. So how do you do it? How do you tactically go about it? What are some of the leading practices to actually execute this? And Amy, let's start with you in terms of your experience and some of the leading practices for successful member engagement and experience.
Yeah, absolutely. And I know we all want that kind of instant fix, right? The low-hanging fruit, the silver bullet, what have you. But what I find is it's commitment to the question. So again, we don't just do research once and then say, all right, we've been there, done that, we don't need to do it again. If we are truly human-centric, member-centric, then we are committed culturally to continuously asking the question, what do our members need most? What frustrates them most? What they want most? If we are their partner in health, how do we partner with them through each moment of the journey? And that can be accomplished through constant listening and co-creation, designing with people who are affected by the solutions we create. I heard somebody say recently, put the power closest to the pain. And so that's about, kind of liberating power structures, like let's involve members in the innovation process, because I think in doing that, we are trying to help people self-service in an extremely difficult and complicated health ecosystem that even those of us that know the most about it are still left confused when we're trying to navigate it for ourselves or our families. So it's really important to keep our eye on, if we're going to part people through their health journey, it's not just for the insurance tasks, it's also for the health tasks, right? So somebody might be trying to find a doctor, but it's because they have symptoms they don't understand. And they don't necessarily know what's wrong with them. And so they might go from specialist to specialist to specialist, trying to figure out even what is their diagnosis. And they need some guidance in that, right? And from a life perspective, they may be moving, recently laid off, going through a divorce, caring for a loved one. And so we're interacting with multifaceted human beings. So the more we can kind of connect up, okay, when this is happening in someone's life, as an insurance company, here's how we support them. If here's where they're at in their health journey, here's maybe how their health insurance company can support them. So that, to Rishi's point, we're dealing with those frustrations that we're seeing in the data and hearing from people, but that we're also kind of looking forward to, gosh, how do we get past some of the frustrations that people have been experiencing for a really long time managing their health.
And Stacey, so in terms of leading practices, all the initiatives you have embarked on at Highmark, can you talk us through some of the lessons learned and where you feel?
Well, yeah, I think to Amy's point, it is about that consistency over time. I remember when we first started the customer experience function, which was 2019 at Highmark, and everybody was like, okay, what's the one, just tell me the one thing to go do. Let's go do the one thing, right? And that was kind of like, everybody was excited about that. And I remember sitting down with an external consultant, and I said, okay, what would you say to that? And they said, the experience doesn't change through one initiative. It changes, when you are consistent over time, and you try to make sure you're hitting all of the spaces where people are living, experiencing your brand, and having those touch points. And obviously that's hard, right? Because you realize that the world is complex. And like Amy said, people are having all of these different touch points that are sometimes even outside of the control of the brand, right? But they do create brand experiences. So, I would say one of the things we learned very early then was, well, don't try to look for that silver bullet. See what we can do to get consistent. And some of that required internal education to a level that I think I didn't probably appreciate when we started. And we were looking for ways to make, the work that we were doing resonate with people, and trying to make it memorable, right? Because when you remember something, it's a little bit easier than go deploy it. And one of the first frameworks that we used was no, go, oh. And it was this idea of you could really help people have a better experience if you help them understand what it is that they need to know at that moment. Where do they go for help, or where do they go for care? And then answer that question of what do I owe? Because a lot of the thematic things that we were already seeing in that research was those were the kind of three fundamental places where people struggled. And even though over time we've kind of evolved some of those frameworks, and there are nuances that I think we didn't quite understand at that time, that whole idea of no-go has kind of stuck with people, right? And it's been, it creates an easy way for you to have a shared language around what it means to deliver a good experience. And I think, you can encounter somebody that has a very operational kind of skill set and background that can appreciate no-go, and it doesn't feel like a fluffy experience initiative, because frankly, that's, I think, some of what organizations get caught up in. Experience work feels like it's over here, and it's just like, it's not, it doesn't drive business value. And the reality is it does drive business value. It can drive business value. You have to find that intersection. And so that for me is another lesson learned, that you got to help people get it, understand it, recall it. And then you've got to help people see that it is core to the business, not just an initiative.
Yeah, and I think that education piece really stands out to me, especially internally, because unless everybody's kind of rowing in the same direction, it's difficult to accomplish such a complicated endeavor. So, no, it makes perfect sense. So, in some of the answers initially, all of you have alluded to technology, importance of technology, and I will even say specifically AI. So this next question, Amy, we'll start with you. How can we responsibly utilize AI to deliver these personalized experiences?
Yeah, it's such a good question, and it's something that I've grappled with a lot, because throughout my career, what's been the unifying factor is human centricity, human-centered experiences, designing experiences that lift people. And when you think about humanizing the health system, when you think about designing technology to make sure that it's good for people, I had concerns about AI, but the way that I look at it is now I'm super excited and I dork out about the possibility of AI to improve people's lives. So I've sort of seen the light in that way. And I think that AI can provide us a solid foundation to stand upon, so that humans can have the best experiences possible with one another and with the systems upon which they rely. And so the biggest opportunity in health and in other industries is really looking at how can we delegate complex administrative tasks to AI to reduce the burden that people have, to find information, fill out forms. They're stuck in the middle of trying to figure out their referrals and their costs and, all of this stuff. Can we start to delegate some of those complex administrative tasks and then find the patterns in that so that we can improve the technological underpinnings of the system? Also hoping that we can deploy AI to help with decision support so that people can always have access to the greatest information. However, through AI, perhaps people can gather a better understanding so they form good questions that they then take to their doctor, or at least they can know what their next step is. I think we can also figure out how to leverage AI to trigger interventions where we start to get proactive and not just reactive, and really get to that precision medicine, or the right thing for the right person delivered via the right channel. So I think for the first time in a long time, I've been working in health for 18 years, and for the first time, I think we can actually solve some of the pretty complex challenges that we've been facing, and do so fairly well with AI. So I'm pretty excited.
And Rishi, I also want to give you a chance to react to this, but I do want to add one piece, right? So the recent survey I read of health plan executives, 78% of health plan executives believe that personalized service based on real-time data and analytics based off of that real-time data will be the number one differentiator against their competition. So yeah, it completely resonates with not just the ground level, but executive level in terms of how AI can deliver that. Rishi, your thoughts in terms of use of AI?
No, I think some very important points, as Amy pointed, made, especially in terms of how do you make AI responsible, is the basically understanding importantly the scenarios in which the AI can be deployed for this personalized experience for members, right? And it the most important part is that to make it controlled by the audience, by the users, right? That's one of the most thing to make it responsible so that they control in terms of what is to be done. And it can be defined in terms of level of interventions as well, because the scenarios, as Amy was talking about, many of the scenarios can guide us in terms of how the AI can be deployed. And you can divide it into multiple levels of intervention. Like level one could be about being just as a health coach, just providing help, help in terms of medication adherence and all that, right? Level two could be a little bit more little bit more personalized in terms of preventive care. When I can observe your lifestyle, I can understand that how you are living, what kind of exercises you're doing and all, so I can observe you better and I can deploy it more responsibly. Level three could be even more predictive around terms of real-time prediction and helping the users. The point I'm trying to say is that when you define these scenarios for the users, you can have a better strategy in deploying this AI more responsibly and inform the audience also that how I'm going to help these tools to make it work for you. And then that builds the confidence of the users and members also that this would work for me in certain ways, right? And that's where your it also informs the back of your data strategy, because the AI works in your capturing the data, what data you're capturing, right? It cannot work without the data, right? So that also makes your data strategy very, very precise in terms of what you should and what you should not be capturing, and the users, the audience of it are also aware about it, so they can give their consent to it to make it more responsible and make it more, of course, personalized. And then final touch point is the delivery of these AI models, right? There are a lot of I'm not data scientist, but we know that hallucination, biases, leaving out the marginal audience, those are all important issues. And I think CTS Tech particularly, we have a very powerful Q&T framework, which has 70-point checklist and scenarios, which ensures this level of accessibility and level of calibration, end-to-end traceability, and it ensures that that happens. So all three in terms of starting from the member scenarios, making your data capturing strategy align with that, and ensuring that delivery has a more responsible way of creating this model is where this entire chain need to be built to make it happen for the AI to be more responsible for the users.
No, it makes perfect sense. And one final thought I would add is it is an iterative process, right? You're not going to come up with this magic algorithm that's just going to crack it. You have to constantly retrain, refresh, get those right data points in with the proper predictive powers within those algorithms to be able to improve them and make them relevant and important enough to be utilized in that function. So I do want to switch topics a little bit. A lot of times, Amy, you and Rishi have mentioned the term human-centered. Can you talk to me a little bit more about this? One thing I'll say is if the audience think about just devices alone, the most effective devices that actually improve health outcomes, and this has been proven through various academia research, the most effective devices are ones that consider human-centric approach as the primary approach to design them. So, Amy, I'll start with you. If you can please talk about human-centered design and why it's so important when it comes to not only digital engagement, but just overall experience.
Sure. I like to think of it as de-risking, to use a business term. But I mean, let's not go ahead and spend a ton of time spend a ton of time and a ton of money on something and get it wrong, right? How do we ensure that we get it right? what does right mean? What does right look like? What outcome are we trying to achieve with this, whether it's a health outcome or a quality measure or a KPI or an NPS score? And then let's prototype early and often, get feedback from the end audience. I mean, I spoke before about including members in the ideation process. Let's make something and run it by them. So even if it's a conversational AI, you could just go make something with engineers and technologists, or you could prototype it to understand what can go right, and let's make it go really, really right. What could go wrong? How do we prevent it? So that we're not just, thinking our ideas are the best and just throwing it out there and hoping it'll all work out, right? And I think through getting that, doing that co-creation and getting that feedback, it's going to help us buy down risk, like I said. Yeah, Rishi, what are your thoughts?
Rishi, yeah.
Yeah, no, I think it's very important because when it comes to, rubber meeting the roads, the design solution which through which the any user of the solution will interact, it has to be thought through and it should not be figment of designers' imaginations or product teams' imagination. It has to be tested and derived from user scenarios as what we have been talking about so far. And, very common terms which is used in the design world, personas, archetypes, journey mapping, are the tools which ensures that the design solutions which you are making are aligned and ensures that de-risking what Amy just talked about. Because whatever you derive, even if you put a signal pixel or radio button or checkbox, these are very small things, and or even like the AI dialogues, right? What you put in, what you select as a text, and words and synthetic of the sentences and all, has to be derived from from
Yeah.
those user inputs, and
And
and then prioritize these needs in alignment with the business needs, of course, and tech prioritization that what tech can deliver. So that gives another lens that we are not just thinking from the business product and technology perspective, but we have right framework from the user's perspective that will help them to prioritize as well, right? And I
yeah.
think iteration is another important thing, that you continuously iterate on this to refine it, as you were talking about for models and all of that. In design world, it's always the case. The usability testing and all is a continuous effort. Amy,
Yeah,
you.
Rishi, sorry, I just wanted to add because you always make me think, and I was thinking about how, when we're working on health insurance, it's we need to figure out how to do things operationally. How's it going to be deployed? How's it going to scale? But there's a tendency in industry to focus on process improvement, and that is well needed. But sometimes whatever we measure, we're honing in on that, and it affects our focus. And so I just want to put a shout out there for broad-based research to be a little open-ended and a little curious about things beyond what we're like kind of zoomed into on the regular.
Yep, makes sense.
Thank you. So I just want to do a quick time check, and we have a couple of questions that I'll get to in a second. But so thus far, we have discussed why experience matters, how to better understand the members, so then you can design programs accordingly to improve experience, successful practices, including role of advanced analytics, AI, human-centered design. But I also want to kind of think about this practically a little bit, especially in today's climate, which there's a lot of cost pressures. I'm sure you've seen the stock prices of the national health plans because of MLR changing significantly over the last couple of quarters. And the expectation is that these cost pressures will remain until there's a little bit of stabilization in the system, let alone the economic outlook. So my question is, how do we prioritize member-centric operations? And Stacy, I want to start with you. What does that business case look like with that attractive ROI, where we can justify the investment in member-centric operations, member-centric experiences?
Yeah. I mean, I think you have to let go of this idea that there is some set of experience initiatives that live over here and you go do them and then you do your other stuff that's good for the business. I think where we've seen the most success is finding the center of that Venn diagram. And, one of our best practices is constantly anything that we are doing, we talk about the customer problems we're solving and the business problems we're solving, the customer metrics we want to achieve, right, as well as the business metrics that we want to achieve, so that before we take any kind of action, we're making sure that we are finding the center of those and that we're not doing something that's either, too member-centric to the point that like it's very bad for the business because you don't want that, or so business heavy that you've forgotten that you're serving a human. And I'll use a very practical example. I mean, one of the very early things I mentioned before the no go, and we did see that people had a real problem trying to figure out what they owe, and that was, when they got the EOB was confusing. When they got the bills from our hospital system, they couldn't understand the bills, right? They didn't have an easy way to figure out how to pay, who to pay, etc. And then we started to look at the business problems that were living in those journey touch points. And frankly, those things were bad for business because it meant people maybe weren't paying when they got the bill. They were calling customer service and often calling Highmark and calling the hospital system. So you've got kind of the double whammy of multiple phone calls trying to figure out what somebody owed. So we felt like there was a really good business case there to reduce that administrative burden while we made a better touch point when they were getting that EOB and that bill. So we significantly redesigned the EOB and we implemented a new billing platform that made it easy for people to set up a payment plan and really like engage with that information quickly, conveniently, when they needed it. And what we saw after that work was a reduction in calls to both call centers, right? So fewer calls about your EOB, fewer calls about your bill. We saw collections improve. So people want to pay their bill. They don't want to be hassled by the collectors, right? At some point, if it's easy to make a payment plan or if it's easy to figure out where to send that check or pay by credit card, people will do that. And that is absolutely what we saw, which is very good for the business. And then, I think the other aspect of this is that you've got to measure and you've got to be dedicated to investing in your measurement process, because the only way you're going to earn credibility for initiatives like this is to have the data that says, I got the pull through that I thought I was going to get, or I didn't get it. Here's why, and here's what we need to change. So we, have developed a fairly robust measure and evolve process that allows us to, at the outset, decide what are the metrics that we intend to move. And we can examine that pull through and we know where we need to go to get the data to understand it. It has helped us make sunsetting decisions. It has helped us identify where we did something that we thought had a good experience outcome, but maybe wasn't quite what we thought it would be. And we've been able to get in there and tweak it very quickly so that we could resolve those issues. And then it has frankly helped us build that story for the business investment to say, we're actually doing these things. We're not just hypothesizing. We are actually seeing the value of this investment, and therefore people want more of that, right? Okay, you did it once, go do it again. So I think those are really important components to any investment ROI discussion.
So would it be fair to say that since you started back in 2019, compared fast forward to today, it's much easier to get those projects in the pipeline and execute?
Absolutely, absolutely.
Amy, Rishi, any thoughts from your end when it comes to ROI? I know there's some relation with a lot of the work you do around human-centered components.
I would just say well done, Stacy, on reinvestment in experience programs. The proof is in the pudding, as they say, and so that's a huge testimonial. So, I mean, to build upon that for folks that maybe haven't got there yet, everything that Stacy said, and start small. Pick a thread. It can feel really overwhelming, pushing a boulder up a mountain. So find, I like to call, micro experiences where everyone is confident that such and such is a problem. Tell the story of the impact of that problem and the consequences it has for the business, and then pivot to the improvement that could be made and what the business impact of that improvement would be, and start small and just build from there. Um, my mother always said, inch by inch, life's a cinch, yard by yard, life is hard. So I just believe in starting small and doing the internal, like, listening to leaders, peers, and team members to piece together what matters most to them so that you can create those like win-win scenarios where everybody feels like they're winning and it's not like a complicated change management and you're stepping on people's toes and such.
I really like what Staj said in terms of not having notion of separate business case and design or experience case. These are like one common thing because that's what the winning formula is. One thing I would just want to add, which worked for us as well, is to democratize design in terms of your user archetypes, personas, journey maps, and all should not be be part of the design studio. It should be in the hands of product owners. It should be hand of the key stakeholders, sponsors. They should know it very well, and making it more common knowledge across the people, so that it's not just the design team which is kind of pushing this agenda from experience point of view, but everybody is involved because, as Stacy and Amy said earlier, that it's everybody's problem, right, to solve it rather than just a design problem to solve it. So that is also very important, that it should not sit in your computer somewhere in your file folder. It should be accessible to all the people all the time, and that it becomes a more common agenda and start making on strategic intervention what you want to achieve from business point of view.
Thank you, Rishi. You know what? Before I ask the last question, I'm going to take a couple of questions here, and if you can go to the headshot mode, that'd be great, Joanne. So the first question, and this is Highmark specific. Highmark's visionary plans have included living health. Does it also employ similar strategies that you talked about, Stacy, since 2019 that you have been employing? And will living health strategy become kind of the beacon for others to emulate and follow?
Yeah. I mean, yeah, so my job as somebody leading experience design and digital only exists because of Living Health, because that was really about making that customer experience and that clinician experience so much better so that people could focus on health, right? And it's about kind of flipping the script. Instead of leading with affordability, you actually lead with experience to get the health outcomes that you want that will deliver the affordability to all of the stakeholders. So I do think all of the things that I talked about are absolutely core to that strategy. And yes, I hope it is a beacon already for people to emulate. I think we have had some good success in especially in the areas where we've got tight clinician partnership. We're really seeing the difference come to life through getting people into care, through some of those experience metrics that are important. And I think it is a model, and it is really aimed at helping the health of the community. And I think that's a really important part of our story. So I do hope others emulate it, and it's great to be part of an organization that is really driving that kind of agenda.
Thank you. One more question here. So when it comes to relatively smaller plans, smaller budgets, ability to transform, capabilities are a little limited. What are the best ways to improve experience? And Amy, let me start with you because you, I think, partially answered this by starting small. But if you can elaborate on that, what can smaller plans do to improve experience and keep their membership and grow?
Yeah, absolutely. So I would definitely start with measurement and listening. So to start tracking, why are people calling? Uh, where are they running into trouble when they're trying to digitally self-service? And then going out and asking folks who aren't necessarily calling the call center or trying to digitally self-service to figure out where are we missing out on their needs. So really get a sense of what are the top frustrations, what are the top opportunities, what are the top priorities, and then from there figure out, okay, how do we most nimbly, most cost effectively address these problems. I actually think small insurers are in a great position to beat the big ones, actually, because they don't have legacy technology or huge budgets, huge teams. They may invest in smaller, scrappier AI technologies that are going to come on the market that are going to solve some of these problems. And they might be able to deploy them more quickly, more effectively, and more boldly and start to see results from that.
That's a great point. I was just talking to a plan recently, and the problem statement was it takes me forever to start up a program and roll it out. This was more in context of behavioral health. And I'm constantly losing to smaller digital therapeutic type vendors in terms of membership and engagement because it takes me a year, my IT department, to do XYZ and finally roll out the program. So no, that's a great point.
Yeah.
All right, there's a couple more questions. Let me just take those because I really want to save the last one as more of a parting note. This question is specifically around underserved populations. So let me just make sure I read it properly. What steps can health systems take to improve member engagement, particularly for underserved populations? Stacey, we'll start with you since you're exposed to both health plan and the health system. I think let's go from there.
Yeah, I think the archetype work that I mentioned before was actually a great starting point for us to start to understand that our population wasn't a kind of one size fits all and that the same thing was going to work for everybody. And what we found is that in some of the archetypes, there are more challenges around social determinants of health and accessibility and that type of thing. So as a starting point, it helped us at least understand the people that we were serving a little bit better so that we can consider how to do that. And I think the other thing that you have to recognize is that those interventions that maybe will work for somebody that is more motivated won't necessarily work for somebody that is maybe on a different spectrum of motivation or fits into a different archetype. And so you've got to do a different, take a different approach. And so one of the things that we've done is to both understand the people. And so we try to intentionally make sure we are hearing from all types of people when we do our research. And it might mean that it's actually a little harder to find those folks to join in a research program because they may be a little bit less engaged, less likely to respond to that offer of giving us feedback. But then in addition, we're finding new ways to collect a lot of that SDOH data and action against it. So I think sometimes, that the healthcare experience is one that requires people to reach out to the health experience versus being reached out to. But what we're able to do as we start to understand, some of people's challenges, we can do more of that outreach when we have the data that we need to know that somebody is struggling with, food insecurity or housing or transportation or something like that. And that has actually been made a very significant difference for us because it allows us to then, when we see something, have that social worker reach out immediately with the offer of help versus somebody having to come search for it, come to us for it. So I think, it starts with understanding, and then it's what are those small interventions and steps that you could take to be where people are and meet them in their space versus kind of requiring them to come to you on your terms.
Yeah, I love that.
Yeah.
I would just add that, trust is an issue, not just in populations that are experiencing disproportionality of outcomes, but, across the board. And so trust is a soft measure, but it has direct impact on NPS. In order to build trust with our membership through experience, we really need to focus on their needs, the relationship, and what makes them different. But I would say, with folks who may have been exploited by research in the past, you have to take a really nuanced and culturally sensitive approach when doing research so that we're ensuring that we understand the needs of folks, but also illustrating our commitment to building trust over time. And I think the shared co-creation and shared decision making can be pathways to building that trust.
I just want to add one point in terms of forward-looking approach on this, that underserved is underrepresented on your data as well. So when you're thinking about technological solutions, AI-based solutions, you have to be very cautious about that. These people may not be accounted for, and your solutions may be biased towards it. So I think that is another important point, that we need to be cautious about that fact as well.
Absolutely, super important. And to that point, related, right? There's a related question around how do you gather data on underserved populations because you don't have enough. I can share a couple of my perspectives, right? There are a number of different ways to do this, especially if you partner appropriately with your providers. Every single visit now requires some kind of form that you have to fill out in terms of what is the mental state, how do I feel today, what are my obstacles today. So gathering that information from all those visits every time a member or patient goes sees a provider is one way. Another is, as soon as enrollment happens, there's traditionally we have HRA that we do, right? But there's more specific questionnaires now on how is your social life, mental well-being, and incorporating those as soon as the enrollment happens, and then tracking those, right? Also, having mechanisms to track is another way to collect it. But I'll ask the audience, any other thoughts on how can you collect data on those underserved populations, get those accurate social determinant information so that it can be addressed when trying to deliver care?
I mean, I would say one of the things that we have done is to get to a single question set that we can share across the enterprise so that when we are taking that information in, it's consistent. Because we found that there were lots of different types of questionnaires, and really like making it consistent, and then starting to rationalize what does this mean, and how do you act upon it in a much more consistent way, has been incredibly helpful for us.
And someone's saying we can use mock CAP
CAP
surveys as
surveys,
well.
absolutely. Yeah. Mock surveys can be proxy surveys that are super important, especially in your geographies, because that's where those CAP surveys really come in. So thank you for sharing that. So I have one final question, and push this appropriately. Works. So for our panel, we have discussed a lot of different elements of not only why experience matters, but how to improve member experience within your organizations, how to navigate the different aspects to get to a better member experience for your members. But if we just kind of step back, and if you close your eyes, fast forward 5 years, I want to hear from each of our panelists. What does member experience look like to you? Each of you come with differing backgrounds, and was just very curious to hear your perspective. And Rishi, we'll start with you, just because you have a more technical background. I want to start there for a second.
Well, I think I always imagine, and I think that's becoming reality very fast, that we move from technological, the way the AI and all enabling us, that will move from reactive experiences and care to more proactive ones, right? Instead of more worrying about people, treating people and serving them, in adjudicating claims and everything, we will be thinking about our member population healthy, more about that. So our focus shifts completely on how do we keep our member population healthy, and that changes the experience for us and for them. I think that scenario change would be a very, very important and very aspect that your each dollar is worth of keeping people healthy rather than helping them to recover from something, some bad health experience, right? And I think from technology perspective, the wearable technology and AI would play a lot of important role to enable that when the personalized member experience would become real-time solutions for our members. So that's the kind of world I would imagine to be that everybody's looking forward, keeping us healthy. So I would love to have part of that.
Great. Stacy, you can go
All
next.
right. Yeah, sure. So I'm going to go a little bit in the other direction. And I think we're going to start to see more simplification of benefit designs. I think, historically, we kind of built complexity on top of complexity. And so when I started in the industry 24-ish years ago, you had HMOs and indemnity plans for the most part, right? And then we added high deductible plans, and then we added co-insurance to all of them, and we added all of these complex ways of aggregating deductibles. And there's just frankly a lot of overhead to that. There's a lot of overhead within plans. The cost to administer those complex benefits, the cost to train your customer service reps in how to use them. I mean, I've been doing this for most of my life at this point, and I still don't understand how my deductible aggregates. That's a total mystery. But I think we're going to continue to see some additional value in being able to simplify those benefits, not only from the perspective of the plan, but the person, right? We know that, at least from our research, people with high deductible plans do defer care. And deferring care is not what we want. That's not how we're going to get the outcomes that people need or that the plans need. And I think things like alternative health plans are really starting to shift in that direction, to try to have much simpler ways for people to engage and understand before they go get that care. So I'm very hopeful that we will maybe see the pendulum swing in the other direction, back towards some simpler benefit constructs.
I love that and hope for that, Stacey. So I'm counting on you. I would say, in the future, in 5 years, first of all, the pace of change is accelerating, and we know this, right? So 5 years could feel like 50 years, or we could inch forward, and that's been my experience in health. It's like, when are we going to get there? But I think we can accelerate the pace of change with AI. So I think in 5 years, members will have a navigational assistant. Some of these exist right now, but they're sort of hard-coded and the logic isn't very intelligent. I think these assistants will know you. They'll also hopefully be made more intelligent with a lot of data about you, even to a precision medicine perspective. It could be your genome, it could be integrated with all of your smart devices, right? So, of course, abiding by HIPAA and personal preferences, but all of the data making this navigational support very intelligent, very tailored to you, even from a psychological perspective. But what that will do is connect people to the right information and the right people, right, at the right time, helping them know what is the best next step. Should I go to the ER? Connecting them with support, connecting them with the perfect specialist in specialty pharmacy, right? If I'm a parent of a child with cystic fibrosis, can I be connected to the people who are best to help me with my child with cystic fibrosis? So more decision support, more care coordination, and that will reduce the cost of care, because a lot of people are using their health insurance card around the ecosystem to try to get answers that honestly could be gotten more effectively. And hopefully what Stacey says is true. People won't avoid care in the future. I have a big hope for that.
Well, certainly appreciate all that perspective. So with that, we'll conclude this webinar. I again want to thank our esteemed panel, Stacy, Amy, Rishi. Thank you so much for sharing your rich experience, your thoughtful insights. Sincerely appreciate it, and I certainly hope the audience appreciated it. So to the audience, thank you for the opportunity and time. We look forward to talking to you again soon.
Thank you.
And to our
Thank you.
speakers, thank you for that great presentation and for sharing your thoughts. And thank you to the audience for participating in today's webinar. This concludes today's presentation. Thank you again and enjoy the rest of your day.